Hi, my name is Dr. Chelsea Campbell, a VA pharmacist, and today I want to show you the right way to use your inhaler called the Wixela InHub. This inhaler is a combination of two different medications, fluticasone and salmeterol. These medications are used to treat asthma, emphysema, and other breathing conditions known as chronic obstructive pulmonary disease, or COPD. So let's get started. When you receive this medication, it will be wrapped in a foil pouch. Take the inhaler, Wixela InHub, out of the foil pouch. The foil pouch can then be thrown away. Then, write the date you opened the foil pouch in the first blank line on the inhaler's label. Next, write the use-by date in the second blank line on the label. The use-by date will be in 1 month or 30 days after you took the inhaler out of the foil pouch. If you receive more than one inhaler, keep the unused inhaler in their foil pouches unopened until you're ready to use them. The number 60 you see on the counter window indicates the number of doses. Each new inhaler will include 60 doses. Each time you use the inhaler, the number will go down and show the number of doses left in the inhaler. When the counter window shows 9 or fewer, a red indicator will appear, which is a good reminder to you that it's time to refill your prescription. Before breathing in the medication from your inhaler, you will need to get the inhaler ready. First, open the inhaler. Hold the inhaler vertically in one hand. Place your other hand on the mouthpiece cover and lower it. Next, while keeping the inhaler in the vertical position, pull the yellow lever down to the purple arrows. You may or may not hear a click. After you have done that, the inhaler is ready to be used. Remember, every time you use the inhaler, you will need to pull down the yellow lever. Be careful not to accidentally waste a dose, which can occur if you move the yellow lever once it has already been pulled down or if the mouthpiece cover closes before you use the inhaler. Now that the inhaler is ready, let's review the steps to inhale the medication. Before using the inhaler, breathe out or exhale for as long as you can. While doing this, hold the device away from your mouth to make sure that you do not exhale into the mouthpiece. Once you have fully exhaled, bring the mouthpiece to your lips and quickly and deeply breathe in through the mouthpiece. Use your mouth to breathe in the medication, not your nose. You do not need to use a spacer with the Wixela InHub. Once you have fully inhaled, remove the mouthpiece from your mouth, keep your lips closed, and hold your breath for at least 10 seconds. If you cannot hold your breath for 10 seconds, hold your breath for as long as you can. Then, breathe out slowly and for as long as you can. The Wixela InHub will deliver the medications to your lungs as a very fine powder. You may not taste or feel the medications. Even if you do not taste or feel the powder in your mouth, do not take an extra dose. Now that you have taken a dose from the inhaler, it is time to push the mouthpiece cover back up to the closed position. Double check that you cannot see the mouthpiece to make sure the inhaler is closed. Once you close the mouthpiece cover, the dose counter will decrease by 1 dose. When the counter window reads 0, there are no more doses in the inhaler and you will not be able to pull the yellow lever down. After you are done, make sure you rinse your mouth out with water and spit the rinse out. Do not swallow the rinse. Rinsing your mouth out after each use of your inhaler will help to prevent a yeast infection in your mouth and throat that can cause painful swallowing called thrush. You have now successfully completed your dose of the inhaler called the Wixela InHub. Great job. Now let's talk about how to store your inhaler. Store this inhaler at room temperature between 68 to 77 degrees Fahrenheit. Keep in a dry place, away from direct heat, humidity, and sunlight. Store the inhaler in the unopened foil pouch and only open the inhaler when ready to use. Throw away the inhaler in the trash 1 month after you open the foil pouch or when the counter window reads 0. Keep the inhaler and all medications out of reach of children. Let's recap a few things about the Wixela InHub. Hold your breath for about 10 seconds after inhaling, and then breathe out fully. After each dose, rinse your mouth with water and spit it out. Do not swallow the water. Do not take an extra dose, even if you do not taste or feel the powder. Do not take the inhaler apart. Do not wash the inhaler, and always keep the inhaler in a dry place. Do not use the inhaler with a spacer device. And that should cover it all. Thank you for watching this video, and thank you for your service to our country.